morning, all. My name is Dr. Khalid Ansari. I'm MD physician. I'm practicing in area of Bhiwandi and Mumra for last 15 years. And today I'm going to addressing you the topic, very common topic of hypertension. As you all know, it is a huge global problem. Almost 20 to 30% of the population is suffering from hypertension, but majority of the people are not aware of this disease. Why? Because it is a silent disease. People think that I am not having any signs, any symptoms, I am not having any problem, then how can I have a hypertension? So let me tell you that this is a silent disease. Only 5 to 10% of the people suffering from hypertension have signs symptoms related to this disease, which are like people sometimes complain of headache, especially in the posterior part of their head, sometimes vertigo, giddiness, sometimes walking imbalance, and many times they also present with a few episodes of bleeding from the nose. Otherwise, majority of time there are no sign symptoms. Only when you go to the clinic or visit doctor for some or other reason, when he checks your blood pressure, you find that your blood pressure is high. So what happens if your blood pressure remains high and you are not aware of it? What can it lead to? As I said, it is one of the major, it's a very prevalent disease and also one of the leading cause of death related to cardiovascular systems, like death happening because of the heart attack, heart failure, or brain stroke in the form of bleeding or blockage of vessels in the brain. It is one of the leading cause of death because of this reason. It can, if it is not treated, it can also leads to problem of dementia, especially in young people. If they are not get treated, they also lose their memory slowly over a period of time. It can also leads to blindness because of the bleeding to the eyes or various hypertension related changes into the eyes. Also, I told about cardiovascular and brain problem. Plus, it can also leads to problem in the kidney. Your kidney may fail and you may require dialysis if it doesn't get treated and remain uncontrolled. And it can also leads to blockage of the vessels in the legs, leading to peripheral vascular disease. So these are the basically lots of side effects of this disease. That's why we need to control this disease. So any person who is more than 25 to 30 years, especially those who are having their parents having hypertension or any lifestyle diseases like diabetes, dyslipidemia, thyroid, or those who are high risk people like having sedentary lifestyle, lots of stress in their life because of the uh, job or other relationships, those who are having sedentary lifestyle, plus those who are overweight, they should at least get their blood pressure checked at least twice in a year. And if they found hypertension, blood pressure is high, normally we call any person having blood pressure of around 120 by T, around that figure, we call them having normal blood pressure. But if blood pressure starts increasing towards 140 by 90, they needs to take precautions. And once it crosses more than 140 by 90, then they require some or other kind of intervention so that their blood pressure always remains less than 140 by 90, preferably around 120 by 80. So they needs to do lots of modification in their day-to-day lifestyle. For example, they need to uh, starts consuming less salt in the diet. They needs to avoid junk food. They needs to eat more vegetables, less of a non-vegetarian food, more of a vegetarian food. They need to eat more of a fruits which contain juices, because it has found to have less decreased better effect on the blood pressure. They needs to be more active. They needs to do more physical activity, regular exercise, walking, cycling, swimming, running, this kind of exercises. They needs to avoid stress. They try to do either yoga or tries to be mentally at health, and certain life habit modifications is also required. For example, if they are smoking or they are consuming tobacco or any similar products, they needs to avoid this in the life. They needs to avoid too much consumption of alcohol. Plus, once you do this, then there are lots of medicines available which your doctor will prescribe to you depending upon your age, your associated other diseases, and your preferences, and looking at your overall cost and long-term usages. There are lots of PP medicines are available in the form of ACE inhibitor, ARB blockers, beta blockers, calcium channel blockers, diuretics, and there are some special medicine. The idea is that once you are prescribed all these medicines, you need to take this medicine at regular time as prescribed by your doctor or physician, so that your blood pressure remains in control. Sometimes you require to have multiple number of medicines to control the blood pressure. You should not get frustrated that you requiring, some people require single medicine, some require 2 3 medicines to control the blood pressure. It depends on their response rate also, but you need to combine medicine intake along with the diet and exercise to get its better effects. Whatever blood pressure reduction we get with the medicine have long term beneficial effect on your cardiovascular health. So it's my advice that you keep checking your blood pressure regularly. Those who are blood pressure patients should follow diet, exercise, avoid stress, and take medicine regularly uh, on time, so that their blood pressure remains controlled less than 140 by 90, if possible around 120 by 80, so that you live long, healthy life. My suggestion is that you should not let any silent disease or silent killer take away fruitful years of your life, so that you remain healthy for long duration of your life. That's my suggestion. So be safe, be healthy, because your health is precious. Thank you.